So, go ahead and introduce yourself for me.
My name's Rachel.
And how long have you been a patient here at Advanced Spinal Care?
Since 2010, so about 8 years.
Okay. So, what initially brought you in to seek care at Advanced Spinal Care?
Well, I had excruciating low back pain where I train horses for a living.
Okay.
And I'm very physical in my job, and I
Yeah.
couldn't actually move or even barely get off the floor because my
Wow.
back had gotten so bad, just chronically over time.
Wow.
I didn't have an injury or anything that caused it to happen. It just started getting really bad. And in the past, I had neck and back issues both, and had gotten cortisone shots in them. And I decided to take a different approach
Yeah.
instead of going to my normal medical doctor and getting injections, because it just seems like the pain always came back.
Yeah. It didn't really fix it. It was kind of a Band-Aid.
It masked it, yeah.
Yeah. So, tell me a little bit about, do you remember your first adjustment or your first experience here?
I do. I remember coming in and meeting Dr. Lipinski and watching a video and doing the extensive x-rays and going through the initial adjustment and the new x-rays, and yeah, it was a pleasurable experience.
Yeah.
As well as it could be.
So, did you find any immediate relief, or was it more over time for you?
I think it slowly did get better. I wouldn't say immediately an amazing difference, but definitely every week I slowly got better and better and better. And I took a good couple months off work just to heal myself and take that time also during that when I was coming in for the adjustments.
Awesome.
Yeah.
So, you said you had low back pain, and you were getting injections in your neck and your low back. Was there anything else that you noticed that happened to start to get better once you had adjustments?
I don't. There could have been, but I mean, I've always been so healthy.
Yeah.
I mean, those are the main things that I noticed. Was, because my low back and my neck would take turns going out. So there's times when my neck was really bad, or I'd have numbness in my arms, and that slowly, definitely got better.
Oh man, numbness. Trying to train horses.
Mm-hmm.
That's huge.
No, yeah, it was bad. So I'd have
Wow.
to stop and shake my arms out and whatnot. So I would say just all in all, I felt a ton better over time. Yeah.
Yeah. And did you have any diagnoses that doctors had given you?
Not really then. I mean, I just had slight bulge discs is what they
Okay.
said I had. I mean, I never was a candidate for surgery or anything.
Okay.
I just had slight bulge discs in my low back of my neck.
Yeah.
And then I came back. So then years later, just I think within the last year, I started getting jaw pain after I had not seen Dr. Lipinski for a while, because of course I got better, and so I stopped coming, which was not a good thing, for my monthly checkups. And then I got a trigeminal neuralgia in my, kind of
Wow.
that pain through my neck into my face, and it got really bad, and that's what brought me back in.
Wow. I've heard that's some of the worst pain you can have.
Ever. Yes, and the medication for it's horrible. So I started coming back again after not being here for a while, and of course I was way out of whack, and
Wow.
so since then, in the last maybe month or two, I haven't had any pain.
Wow.
And I'm not on any medicine for that.
That's amazing.
Yeah, and my low back and neck have been great, so.
That's incredible. And you're
Yeah.
still able to train horses.
Mhm.
You're still
Oh,
able to do your
absolutely.
job.
I think
That's
I'm probably
so-
stronger and healthier than I was back in my late 20s, early
That's
30s.
awesome. That's
Yeah.
awesome. That's huge. So, if somebody came up to you and said, this is what I'm facing, if they had what you were diagnosed with, what would you tell them if they were just feeling at the end of the rope with the pain?
Oh, I would absolutely tell them to come to see Dr. Lipinski.
Yeah.
And try the upper cervical adjustments, because it has really changed my life. And I know it's I'm not always good at explaining it to people, but I know if I can get them in here and they can see the difference, and they can go through the orientation and really see what's going on, they understand it.
Yeah.
And so I definitely have told quite a few people about them,
Yeah.
And I'm not one to be pushy about telling people to go, but sometimes they can see what you're experiencing and how healthy you are, and just want to try it themselves. So.
Well, awesome. Thank you for sharing your story with us.
You're welcome.
Appreciate it.
Mm-hmm.